EMS provider practices should be based on the most up-to-date COVID-19 clinical recommendations and information from appropriate public health authorities and EMS medical direction. Using the most appropriate personal protective equipment is essential when dealing with possible and confirmed COVID-19 cases. EMS providers who will directly care for a patient with possible COVID-19 infection or who will be in the compartment with the patient should follow standard precautions and use the PPE as described here. The recommended PPE includes a face mask or N95 or higher level respirator. Face masks provide protection from splashes and sprays. An N95 or higher level respirator should be used when performing or present for any aerosol generating or high-risk clinical procedures. Eye protection, such as goggles or disposable face shield that fully covers the front and sides of the face. Personal eyeglasses and contact lenses are not considered adequate eye protection. Patient examination gloves. Double gloving is preferred. An isolation gown. If there are shortages of gowns, they should be prioritized for aerosol-generating procedures, care activities where splashes and sprays are anticipated, and high-contact patient care activities that provide opportunities for transfer of pathogens to the hands and clothing of EMS clinicians. This includes moving a patient onto a stretcher. These recommendations for PPE also cover the provider driving the ambulance. Drivers who will provide direct patient care, such as moving patients onto stretchers, should wear all recommended PPE. After completing patient care and before entering an isolated driver's compartment, the driver should remove and dispose of PPE and perform hand hygiene to avoid soiling the compartment. If the transport vehicle does not have an isolated driver's compartment, the driver should remove their face shield or goggles, gown, and gloves and perform hand hygiene. A respirator or face mask should continue to be used during transport. All personnel should avoid touching their face while working. On arrival, after the patient is released to the facility, EMS clinicians should remove and discard PPE and perform hand hygiene. Used PPE should be discarded as normal.